My name is Patty Kronheim, and I'm the campaigns director of the New Jersey League of Conservation Voters. And I am really excited to be here today for what promises just to be an amazing presentation. Here at New Jersey LCV, we represent Democratic, Republican, and independent voters who elect environmentally responsible candidates to state and local offices, advocate for strong environmental policies, and hold our elected officials accountable to safeguard the health of our communities, the beauty of our state, and the strength of our economy. A little housekeeping before we begin. Just make sure that you stay on mute throughout the presentation. That'd be really helpful. And just check that your name is your name. So rename yourself if you're not, so we know who's online and who's asking questions. That'd be great if you could do that. And also, if you'd like to ask a question, please type it in the chat box, which is below. And we'll try to get to as many of them as we can at the end of the conversation today. We're going to have hopefully a really robust Q&A. We have a really terrific program for you today. We've got two leading experts here, Dr. Steve Averbuch and Andee Krasner, to talk about the intersection that may not always be at the top of mind, but impacts us every day. We're going to discuss the intersection between climate change, air pollution, and health. So first, I want to thank our promotional partners at the New Jersey State Conference of the NAACP, Rethink Energy New Jersey, and New Jersey Conservation Foundation for helping us to get the word out for this important webinar. So one of our, I see Marcus Sibley is here with us. Marcus is the chairman of the Environmental and Climate Justice Committee, as well as the Communications, Press, and Publicity Committee of the New Jersey State Conference of the NAACP. And Marcus, I'd love for you to say a few words before we start. If you'd like to do that, that would be fantastic. Let me hand it over to Marcus.
Good morning, everyone. Can you hear me?
Yeah, we can hear you.
All right, great. Good morning. My name is Marcus Sibley. I bring greetings on behalf of our president, Richard Smith, from New Jersey State Conference NAACP. I'm excited to be here. This is in the line of the work that needs to be done. We need a more informed public so that all of us will be on the front lines fighting against these polluters. All too often, people of color are vilified, ostracized, and ultimately penalized for certain actions and outcomes. Generations of Black people feeling inadequate and disconnected, consequently buying into the narrative created by people who don't even value their lives. Why? Because we have things like pollution. And this is why this is important. So often we have been blamed. Under our watches, the school to prison pipeline has exploded. Infant and Black maternal mortality is outrageous, especially in the state of New Jersey. And so often our communities have been blamed. A finger has been pointed at us as if we've done something wrong. Unfortunately, we've internalized that. But now we're learning that pollution has a direct tie to all of these things that we've been ostracized and penalized for. Our young people getting in trouble. But guess what? There's a tie between air pollution and cognitive abilities and be able to pay attention in school, able to retain information. All of these things are impacted by pollution. So that's why seminars and webinars like today are very important. I'm very grateful for our health experts that we have on hand. And I'm also grateful for the organizations like the New Jersey, sorry, I had a phone call coming in, like the New Jersey League of Conservation Voters and everyone else involved. Thank you so much for keeping this relevant. We have to keep this relevant. Too many people are dying. And while we're out fighting the police with all this passion, we need to come back in and fight these polluters because pollution kills more of us than police ever will. So thank you so much for the time. And Patty, thank you for all the work you've always done. Lee, thank you for the great work you guys are doing. And I'm looking forward to learning today. Thank you so much.
Oh, thank you, Marcus, for those really thoughtful remarks. And we're really grateful to have the NAACP joining us today. So thank you. You know, for so many New Jerseyans, far too many New Jerseyans, the air we breathe, routinely receives unsatisfactory grades from the American Lung Association. And if you live in a predominantly Black or brown community, you are disproportionately more likely to live in an area that has worse air pollution than if you live in a whiter, more affluent community. We know there are many reasons for this. Black and brown communities are more likely to be near transportation corridors and ports, that are subject to incredibly harmful amounts of localized air pollution from diesel emissions, industrial facilities, incinerators, and power plants. And one place recently we're seeing the alarming implications of air pollution and poor air quality is with COVID-19. We're seeing that Black and brown communities have higher mortality rates from COVID-19, and one of the driving factors of that being air pollution. And today also, we're going to learn about something a little new that maybe many of us haven't heard as much about. And that's going to be that air pollution doesn't just end at outdoor exposures. Indoor air pollution poses a significant risk to public health, especially to low-income, predominantly Black and brown communities who are more likely to live in older housing stocks with older appliances, less efficient insulation, and lack of proper ventilation systems. The bottom line, and what we'll walk away with today, I'm sure, is that the air we breathe matters. And today we're going to learn more about why, how much it matters, and what can be done about it. So I'm going to hand it off now and introduce one of our expert speakers, Dr. Stephen Averbuch. Dr. Averbuch is a medical oncologist and pharmaceutical industry veteran with more than 35 years in oncology drug development. He has a track record as a strategic builder and leader of clinical research, and he's contributed to multiple drug and companion diagnostic approvals in the US and other major markets. Dr. Averbuch recently retired as Vice President and Head of Precision Medicine at Bristol-Myers Squibb. He's authored over 60 peer-reviewed publications and book chapters, busy guy, and is a co-author on 1 patent. He's currently on the Caris-LS Scientific Advisory Board, the Sustainable Princeton Board of Trustees, the Steering Committee of the National Biomarker Development Alliance, the Advisory Board for the University of Kansas Institute for Advancing Medical Innovation, and he's a member of the American Society of Clinical Oncology and the American Association for Cancer Research, having served on multiple committees for both organizations. He's the 2014 recipient of the University of Illinois College of Medicine Distinguished Alumnus Awards. And in his spare time, he's going to be able to be with us today. I'm very excited now to hand the mic over to Dr. Averbuch to begin our conversation. Steve, welcome.
Thank you very much, Patty. Can you hear me okay?
Hear you great.
Okay, good afternoon. And I'm also very excited to be here, to be able to share with you what little knowledge I know about this field, but also very excited to hear what Andee has to say about indoor pollution and something that was a real eye-opener to me as we were preparing for this webinar today. So let me, and a great introduction. I was hoping you could have made it a little shorter and given us more time to talk, but let me just say, you may wonder why a medical oncologist is here speaking to you today. As you heard, I am a physician. I'm trained in internal medicine and medical oncology. I've spent the better part of 40 years engaged in basic and clinical cancer research for bringing better treatments to patients. I am not a public health or environmental health expert. So why am I here? I'm here as, just like all of you, we have a committed interest to this area. I'm concerned regarding climate change. I want to draw more attention to the rapid and profound actions required from all of us to address the adverse health effects from air and water pollution, environmental degradation, climate change-induced events such as hurricanes, wildfires, and flooding. And just like cancer, climate change may seem complex. The science clearly is complex, and it may be difficult to understand. But like all health-related topics, it is incumbent on us to understand it to the level where it impacts our own individual personal health and the health of our families and friends. So the more aware we all are of these health effects related to climate change, the more we can do as individuals and collectively to sustain our own personal future as well as the future of the planet. So the next slide, to introduce this topic, this is a slide that's provided by the CDC. and it shows how climate change impacts a wide range of health outcomes. Normally, I would have this slide animated where that inner circle is revolving around, and how it demonstrates that rising temperatures, more extreme weather, rising sea levels, increasing carbon dioxide levels all impact on the various exposures that you see in the outer ring. And from each of those, the subsequent health outcomes that result from these changes in exposure due to climate change. So as you can see on this slide, the climate change impacts on health are widespread, they're diverse. All the data tells us that it is growing rapidly. High temperatures, poor air quality, and wildfires causing raising rates of respiratory and cardiovascular diseases, rising temperature and changing rainfall patterns, increasing risk and spread of vector-borne diseases such as dengue fever and malaria, and tick-borne illnesses. The collapse of fisheries and declining agricultural production threaten global food supply, and water scarcity, drought, and poor water quality increase the risk of waterborne diseases. Interestingly, extreme weather events not only cause the immediate perils of death, injury, and displacement, but there's a lot of data recently showing how it impacts on our and is disruptive to our healthcare delivery systems, just like we've experienced from COVID-19 and seeing how we've overwhelmed our health delivery capacity. Severe weather events can have that same impact in terms of our access to healthcare. So what we're going to do today is focus on just, and if you click once, Henry, there you go. We're going to focus just on the health impact of air pollution. I will be speaking on the general effects of air pollution and health. And it's going to be focused primarily on what's known regarding outdoor air pollution. This will serve as an introduction to the topic that Andee will speak on around indoor air pollution. So let's move on. This is just a slide recognizing that greenhouse gases, these are the major greenhouse gases that contribute to global warming and climate change, shown on the left. On the right are the primary pollutants responsible for air pollution. And as you can see, there is overlap and direct connectivity between these components. So in the next few slides, I'm going to drill down on the three major pollutants that contribute to air pollution and as it relates to human health. Next slide. The first of these is particulate matter. Particulate matter comes from a whole variety of sources. They come in different sizes. And the figure on the right shows a cartoon of a human hair, which is between 50 to 70 micrometers in diameter. The particles that we're talking about are the fine particles, which are labeled particulate matter 2.5, standing for representing particles less than or equal to 2.5 micrometers, just a fraction of a human hair size, and larger particles such as dust, etc., that are at the 10 micrometer diameter. And these are important because they have different impacts on our health. The small particles, like dust from construction and mining and agriculture, largely affect the larger airways or nasal and upper airway passages, whereas these fine particles, which are a major component of fossil fuel consumption, have much more damage down in the lower portions of our respiratory function, as well as other effects on our heart and other organ systems. Next slide. So that's particulate matter. Then, is everyone on mute? I'm hearing some.
Yeah, if you're not on mute, please mute yourself. Thanks, guys.
Thank you. The second major component of air pollution is ground level ozone. Now, people know about ozone. It comes in two varieties. It's a gas that occurs both at ground level and in the Earth's upper atmosphere. So distinct from the upper atmosphere stratospheric ozone, which is a good ozone because it protects us from the harmful effects of sun's UV rays, the ground level ozone is harmful to human health and vegetation. It's formed by a reaction, a chemical reaction of volatile organic compounds, which are also products of fossil fuel combustion, nitrogen oxides, high temperature, and sunlight to produce the ozone. And this is particularly prevalent on those poor air quality index days during the summer months within and downwind of urban areas. Next slide. So from these two major components, what are the health impacts? They are quite serious and profound. As irritants on a short-term exposure basis, they decrease our lung function, and this applies to everyone. They cause, for those patients that have underlying respiratory and cardiovascular diseases, they will worsen the severity of those diseases. And all of these effects, particularly in those vulnerable populations, can lead to hospitalizations or death. So on the short-term basis, these are primarily irritants. But on the long-term exposure basis, these pollutants are actually tissue damaging. They damage our respiratory and cardiovascular systems. They can be responsible for creating a new onset asthma condition, particularly in children. They've been associated with certain neurological disorders, including dementia and Parkinson's disease. And again, these long-term exposures can lead to cardiopulmonary and lung cancer deaths. Next slide. The third component I want to talk about very briefly, and this will be emphasized more during Andee's talk, is nitrogen dioxide, another fossil fuel combustion product. So in addition to being a contributing factor in ozone production that I mentioned earlier, nitrogen dioxide causes a range of harmful effects to the lungs, similar to what I've just described: inflammation, worsening of symptoms in susceptible people, reduced lung function, asthma attacks, greater likelihood of emergency department and hospital admissions. Next slide. So who does this all affect? Well, air quality affects people because of exposure and/or sensitivity. Exposure is in the vulnerable populations, certain occupations, professional drivers, parking lot attendants, construction workers are just examples of people who have direct exposure to the air pollutants that we've just talked about. Athletes and outdoor workers on high pollution days. But as Patty and Marcus have already alluded to, perhaps the most significant vulnerability is in those populations living and working near pollution sources, particularly our low-income communities and communities of color. And the second group of people, which are often overlapping with the first group that I just described, are patients who are most affected due to sensitivity. Underlying asthma, an estimated 25 million Americans are affected by asthma. Chronic obstructive pulmonary disease, which are many of you refer to this as emphysema, making it a chronic obstruction, making it difficult to breathe. More than 12 million people are known to have COPD, and 24 million people may have the disease and not even know it. It's usually the third or fourth leading cause of death in the United States annually, approximately 120,000 deaths per year. Heart disease remains the leading cause of death in this country, and allergies. People with allergies are particularly susceptible to the effects of air pollution, along with young children, including pregnant women and the elderly. Next slide. So let's look at some numbers. What's the actual impact of all this? The 2015 Global Burden of Disease study listed air pollution as the fourth highest ranking global mortality risk factor. Annually, an estimated 200,000 premature deaths occur in the US from combustion emissions alone. And the World Bank estimates $18 billion in earnings were lost due to premature deaths caused by air pollution in 2013, while asthma and its management cost an estimated $50 billion in direct medical costs and $6 billion in lost productivity. And that was back in 2007. The data is even more significant today. Next slide. As an oncologist, I would be remiss to not talk, at least for one slide, about lung cancer. As everyone's well aware, it's a very prevalent disease. It's the primary cause of cancer mortality worldwide, accounting for 2.2 million incident cases and 2 million deaths in 2017. The US numbers are about 1/10 of that, respectively, 200,000, over 200,000 cases and about 200,000, close to 200,000 deaths per year. Smoking cessation clearly has contributed to a decrease in its mortality, but only marginally. The Lancet Commission on Pollution and Health estimated that all forms of pollution can cause up to 43% of lung cancer deaths. In particular, the particulate air pollution, the PM 2.5, can account for 15% of lung cancer deaths. And this statistic has actually increased by 20% in the past 3 decades. If reductions in emissions can be achieved, the experimental models show that air pollution-related lung cancer will ultimately decline over time. Next slide. 2020 marks the 50th anniversary of the Clean Air Act, the landmark law that has driven dramatic improvements in air quality over its 50-year history. It's prevented an estimated 130,000 heart attacks, 1.7 million asthma attacks, and 13 million lost workdays over the decades between 1990 and 2010. And it's estimated that in 2020, 230,000 adult premature deaths and 280 infant deaths will be prevented. The graphs here show the data for New Jersey compared to the US, and they track pretty well. Since 2003, air pollution in New Jersey decreased 40%, with the particulate matters decreasing from 13.4 to 8 micrograms per cubic millimeter of air. And the graphic shown below that on the right, in the right lower left-hand corner, is from the April American Lung Association State of the Air report, showing county by county their health grades based on particle pollution. So this is good news. However, next slide. New Jerseyans still breathe some of the worst air in the US, and this is that same county by county graphic showing the ozone grades according to the ALA criteria, showing that a number of counties, the ones in red, have a report card grade of F. That same report concluded that nearly half of the people in America, 150 million Americans, live in counties with unhealthy ozone or particle pollution. And that represents an increase over the past 3 reports, which are done in 3-year segments from the ALA. So too many counties are still reporting air pollution that threaten health, and climate change impacts continue to threaten progress in this area. Based on a recent report from Europe, it's estimated that these air pollution figures account for about 5.76 months of average life loss per person over the entire population. So the important message here is the Clean Air Act must remain intact and enforced, and perhaps expanded in order to continue to protect public health. I'm going to skip over the next slide. It's simply a table from the same report showing the county by county data, and recognizing that broken down by the risks levels, you can identify, the impact that air pollution is having on the proportion of New Jerseyans and their health status. And you can all access this report in the lung cancer, American Lung Association stateoftheair.org report. Next slide. Just very, very fast, because I want to make sure Andee's got plenty of time to talk about her topic. Let's talk just for a minute about COVID-19. This is a map, a satellite map from NOAA, or the European Space Agency in this case, showing the levels of nitrogen dioxide in the atmosphere prior to the shutdown and post-shutdown. Again, nitrogen dioxide is not a direct, it's not a direct greenhouse gas, but it is an indicator of fossil fuel emissions. And the impact on pollution has been dramatic, as shown on the next slide. Picture of one of our favorite cities, a before and after picture. Additional data, and this is again from Europe, has shown that because of the reduction in the and the lower exposure to the pollutants during the shutdown, it led to a striking reduction in certain 11,000 deaths in the European continent, primarily related to emergency room visits, preterm births, and asthma. So the particulate matter and nitrogen oxides during the lockdown reduction has directly led to life-saving outcomes. The bad news is that emissions have rebounded nearly to pre-pandemic levels, and therefore we can expect all of these realized beneficial health effects to dissipate. Next slide. So Patty, I think, alluded to this. We know that urban air pollution may enhance COVID-19 case fatality and mortality rates in the US. These are two very recently published publications just in the last several months that looked at long-term air pollution levels in more than 3,000 US counties, the entire country, that also had mortality data from COVID-19 available. One study showed that a small increase in long-term exposure to the particulate matter 2.5 leads to a large increase in COVID-19 death rate. And a second study showed that similar association with nitrogen dioxide exposure and population susceptibility to death from COVID-19. And again, it's the most vulnerable populations, those living in urban centers, those living near pollution centers that have underlying health conditions that create the perfect storm and lead to the disproportionate impact of COVID-19 morbidity and mortality on those populations. Next slide. So this is my summary slide. Next slide, Henry. Yeah, thank you. So what we've covered in the last several minutes is that air pollution can directly impact and affect multiple organ systems, causing significant symptoms, disability, death, and strain on the healthcare system delivery infrastructure. Substantial opportunities exist for policy changes to substantially reduce greenhouse gas emissions and to slow climate change. Importantly, many of these climate policies will result in immediate reductions in air pollution, as we saw during the shutdown, the economic shutdown, and the reduction of fossil fuel emissions. For example, meeting the Paris Agreement goals is estimated to save 1 million lives every year by 2050 as a result of declining air pollution, including reductions in cancer mortality. So with that, I want to thank you. The worst that can happen if action for ourselves and for our planet is that we might just create a better world, even for nothing.
Great. Thank you so much, Steve, for that really thoughtful overview of why air pollution matters, why we should care. I'm going to, I don't see any questions in the chat, so I'm going to assume people are holding their questions to the end. And right now, it's my pleasure to introduce Andee Krasner. Andee earned her master's in public health from Yale and is a program manager for climate and health for Greater Boston Physicians for Social Responsibility. She volunteers with Mothers Out Front, founding their health impacts team, which is where I had the good fortune of meeting Andee. She's a leader in researching and disseminating information about the health benefits of electrification. Her work focuses on the intersection of the built environment, climate change, and public health. Most recently, she's co-author of the Health Effects of Gas Stove Pollution, a joint report from the Rocky Mountain Institute, Physicians for Social Responsibility, Sierra Club, and Mothers Out Front. It is my pleasure to introduce the wonderful Andee Krasner, someone I also happy to call my friend and co-volunteer with Mothers Out Front. Thanks, Andee. Take it away.
Thank you, Patty, and thank you, Dr. Averbuch, for a wonderful overview on how dangerous air pollution is to human health. Like Patty said, my name is Andee Krasner. I'm really pleased to be here and have the opportunity to talk with you today. I'm here not only because I'm a public health professional, but because I am a parent and I'm concerned about the impacts of climate change and air pollution on children. I'm going to discuss the health impacts of indoor and outdoor pollution from burning gas in buildings. And the reason it's really important to talk about this is that surveys show that the majority of people think that natural gas is a clean fuel, but actually it's a source of both carbon pollution and air pollution. And in this presentation, I'm going to refer to natural gas as methane gas because I think it's a much more accurate description. Next slide. Let's start with looking at New Jersey's carbon emissions profile. Buildings are the second largest source of carbon behind transportation, and 1/4 of the emissions in New Jersey are from buildings. And the darker teal bar shows more than half of these emissions are coming from residential buildings. This carbon from residential buildings comes predominantly from methane gas heating. About 78%, that's a large amount of people, heat their homes with methane gas in New Jersey. Burning methane gas in your home is not only bad for the planet, but it's also contributing both to indoor and outdoor air pollution, which is, as Dr. Averbuch just so wonderfully described, making people sick. Next slide. You can see in this methane gas advertisement, companies paint gas as clean, and they claim that it reduces air pollution. But that is really only in comparison to coal, which is not a great comparison. And it's anything but clean, and it is a source of pollution. The medical community is increasingly concerned with the health impacts of gas, and the New England Journal of Medicine published The False Promise of Natural Gas in December last year, discussing how gas harms health all along its entire infrastructure, including its use in buildings. Next slide. We'll start with outdoor air pollution. Next slide. In New Jersey, buildings are the second largest source of nitrogen dioxide pollution from methane gas. This is the same as the carbon pollution. Combined, buildings produce more than 9 times more nitrogen dioxide than power plants, and a little more than half as much as light-duty vehicles. A large part of that pollution comes from residential homes that are heated with gas and other fossil fuels. And most people just don't think about this because when we heat our homes, we don't really think about where that pollution is going, but it's being vented directly into our neighborhood streets. Next slide. One of the reasons nitrogen dioxide pollution is important, as described before, is that it's a precursor to ground level ozone. And this can worsen bronchitis, emphysema, and asthma, and leads to a lot of increases in medical care utilization. In 2020, 9 counties in New Jersey received a failing grade from the American Lung Association's grades on ozone air pollution. Next slide. This slide shows pollution-related deaths by sector over 3 different time periods. And you can see here that buildings are the #1 source of pollution-related premature deaths in New Jersey. And unlike the other sectors, it's actually on the rise. These are deaths from particulate matter and ozone and are from all combustion sources, not just methane gas. Next slide. So what are the costs of using gas appliances? Our HVAC systems, water heaters, dryers, and stoves? When you consider the externalized costs of healthcare, it's nowhere near zero. I don't have data for New Jersey, but a study in California found that if all these gas appliances, stoves, furnaces, hot water heaters, were replaced with electric alternatives, it would save $3.5 billion in healthcare costs alone. Next slide. Outdoor air pollution is not the only kind of pollution we're exposed to. In fact, indoor pollution is worse than outdoor pollution, unfortunately. Next slide. We spend the vast majority of our time indoors, 90%. I'm told that whales actually come up for air more than we go outside. And yet we don't regulate indoor air or spend much time talking about it at all. We spend 65% of our time in our place of residence, and that's likely much more during COVID. And the EPA states that indoor air is generally 2 to 5 times worse than outdoor air. Indoor air quality is affected by a variety of factors: smoking, humidity and mold, the type of heating in your home, what type of ventilation you're using, and what I'm going to focus on today, the type of stove that you cook on. And we've already heard that nitrogen dioxide is bad for health, but homes with gas stoves have 50 to 400% more nitrogen dioxide emissions than homes with electric stoves. Next slide. We often get asked, how do we know the pollutants are coming from the gas stove and not just from cooking itself? Well, everyday cooking produces a certain level of pollution, whether you're using gas or electric stove, and that type of pollution is particulate matter. This is mostly dependent on what type of cooking you're doing. So if you're frying in oil, that creates particulate matter. All of us who have cooked with oil, you can see that coming up from your pan in comparison to when you're steaming something. But the byproducts of burning gas are not only particulate matter, they're nitrogen dioxide, carbon monoxide, formaldehyde, and other volatile organic compounds. So when we're cooking with a gas stove, we not only get a lot more particulate matter, 2 to 12 times more, we get a larger variety of pollutants. Next slide. So indoor nitrogen dioxide emissions from gas stoves often exceed our outdoor standards. The US EPA 1-hour average is 100 parts per billion. To give you a sense of what a parts per billion is, it's like adding a drop to an Olympic-sized pool. So we're talking about minute amounts, but it makes a big difference on health. And I want you to remember 100 parts per billion, because when I talk about kids, the numbers are going to be much smaller as to what is healthy for them. In the second table, you can see that common cooking activities have peak nitrogen dioxide concentration levels that exceed EPA outdoor standards. Baking a cake, for example, causes nitrogen dioxide concentrations to peak at about 230 parts per billion. While peak concentrations are not directly comparable to the 1-hour average, a UCLA study modeled 1-hour averages and found that cooking with a gas stove and baking for an hour exceeded the EPA outdoor ambient air quality standards more than 90% of the time. And another study by the Lawrence Berkeley National Laboratory showed that in houses that were fewer than 1,500 square feet, indoor air exceeded EPA ambient air standards more than 83% of the time when people cooked with a gas stove and didn't turn on ventilation. And this goes up to 100% of the time when the house is smaller than 1,000 square feet. So what do we know so far? We know that indoor air quality is generally worse than outdoor air quality, and that gas cooking stoves contribute high levels of known air pollutants. But how does that translate into health impacts? Next slide. I'm going to focus on children because they're more susceptible to illnesses associated with air pollutants than adults. They have higher breathing rates and they have immature respiratory and immune systems, so it makes them more sensitive to air pollution than adults. In a number of peer-reviewed studies, gas stoves and nitrogen dioxide are shown to increase the risk of respiratory illnesses in children, which includes not only asthma, but pneumonia and bronchitis. And just recently, in 2016, the EPA Integrated Science Assessment for Oxides of Nitrogen, which is this 1,000-page long document looking at almost all studies around the world on nitrogen dioxide. They assess that nitrogen dioxide exposure, the relationship to asthma, they changed it from likely causal to causal. So that's all to say that the more we learn, the more we understand how bad nitrogen dioxide is for respiratory illnesses. Short-term and long-term nitrogen dioxide exposure is linked to clinically relevant increases in airway responsiveness, emergency department visits, and hospital admissions, as well as the development of asthma. Nitrogen dioxide exposure is also associated with increases in susceptibility to allergens, cardiovascular effects, and learning deficits. And unfortunately, children are not the only ones affected by nitrogen dioxide. According to the EPA, other populations like elderly and adults with underlying illnesses like asthma, COPD, and heart disease are particularly vulnerable to nitrogen oxides as well. Next slide. In this really well done prospective study in Massachusetts and Connecticut children who had asthma, you can see that there is a dose response relationship between how much nitrogen dioxide is in the home and the severity of the asthma symptoms. So as nitrogen dioxide creeps up, so does the risk of severe asthma. The symptoms get worse with nitrogen dioxide levels as low as 11 parts per billion. Remember, the 1 hour average by the EPA standard is 100 parts per billion. So about 10 times more than what actually affects a child with asthma. And you can also see that the risk of severe asthma symptoms goes up with a gas stove, and then again with a gas stove with a pilot light. Next slide. A meta-analysis, which combines the data from a number of different studies, in this case 43 different studies, was done, and they found that cooking with gas, which not only has nitrogen dioxide, but a variety of other co-pollutants like particulate matter that we discussed in the beginning, increases children's risk of current asthma by 42%. But there is good news. We also know from a very well-designed prospective study in Los Angeles that when ambient nitrogen dioxide is reduced, asthma rates decline. So researchers found that for each 4.3 parts per billion, 4.3, there's a reduction in new cases of asthma. So we have really good evidence that reducing nitrogen dioxide pollution not only reduces new cases of asthma, but it lessens the severity of symptoms for those with asthma. Next slide. And this is particularly important for New Jersey, where 1 in 11 children have an asthma diagnosis. And that's actually much higher in low-income communities. And you can see here that in a survey of asthma triggers done in New York, unfortunately, I wasn't able to find this in New Jersey, but this has been done in Massachusetts too, and they find the same thing. Gas cooking and fireplaces are listed as the #1 or is the most common trigger for asthma. Next slide. So lower income households are at higher risk of being exposed to high level of gas stove pollutions. And this is really a health equity issue. The reason for this is lower income households usually live in smaller unit sizes. Remember that homes that are less than 1,000 square feet exceed outdoor standards for nitrogen dioxide 100% of the time if they're not using ventilation when cooking. They're more likely to have more people in the home, and low-income families are more likely to live in older homes and have less control over the maintenance of appliances. Older homes may have gas stoves that haven't been properly adjusted or that have pilot lights, and they're more likely to have inadequate ventilation over the stove. Low-income households are also more likely to use stoves and ovens for heat, and they're more likely to have higher exposures to outdoor pollution. And because they have a higher asthma burden overall, it makes them more sensitive to these lower levels of nitrogen dioxide. Next slide. So what can we do as individuals to make our kitchens healthier? So if you're cooking, you can turn on your over the stove range hood. Using an externally vented range hood when you cook has been shown to be effective in reducing air pollution from burn gas and reducing respiratory symptoms in children. Vented range hoods have the highest pollutant capture rates for back burners, so it's better to use the back burners than the front burners. And the reason I'm emphasizing vented is because many range hoods are not vented to the outdoors. In fact, in researching this, I found that mine was not vented to the outdoors. If they're not vented to the outdoors, they're just recirculating the air pollution, and it's not that useful. If mechanical ventilation isn't possible, open a window. This will reduce indoor air pollution as well. And I understand, because I live in Boston, that it's not always possible to open a window in the winter in New Jersey. And a lot of people have windows that don't open at all. So if you can't properly ventilate, you can reduce air pollution by minimizing your use of the stove by using electric appliances like your microwave or a kettle for boiling water. You can also try a plug-in induction burner, which costs about $50 at IKEA. And when it's time to replace the stove, switch to an electric stove or an induction stove, because removing the source of the pollution is really the best way to reduce air pollution. Surveys have shown that less than 30% of people actually use their ventilation. As homes are retrofitted and energy efficiency goes up, reducing air pollution is even more important because there's less natural ventilation. I do want to acknowledge that the responsibility to address indoor air pollution cannot be left solely to individual action alone. We also need policy changes to ensure an equitable transition to low pollution homes. So what can we do at a policy level? The first thing we can do is eliminate gas pollution as soon as practical in schools and low-income housing. Funds should not be used to purchase or install appliances that could pose a health risk to children and adults with underlying health conditions. Policymakers should consider subsidies and tax breaks that favor electric appliances like HVAC systems, water heaters, dryers, and stoves, to make them cost competitive in purchase price and operating expenses. There's a great program in Maine, Maine's housing, it's called the Maine's Housing Heat Pump Program. They pay for the cost and installation of a heat pump for eligible Maine homeowners. Cold climate heat pumps are 3 times more efficient than gas furnaces and much more efficient than the old baseboard heating systems that we know of when we think of electric heating. So in summary, electric buildings are healthier, they're safer, and they're better for our planet, and we should invest in them. Thank you.
Thank you, Andee. That was really eye-opening. I'm sure everyone agrees with me on that. I think we have some questions in the chat, and they're mostly centered around what can we do, and comparing to other forms of energy as well. One of the questions, you raised policy as an issue, and we know that getting buildings off gas is an essential part of New Jersey's clean energy transition. It's part of the Energy Master Plan. Honestly, I'm frankly stunned by the health impacts from buildings that you listed. That buildings is number one in terms of harms, and that's growing. So, what policies that you or Steve, please feel free to jump into? What policies do you both think, or have you seen, are most effective for helping us get off gas, and in the most equitable way possible for those who are burdened the most get the fastest relief?
Well, for decarbonizing buildings, there's been some pilot sites in Massachusetts looking at district level geothermal, because this is a way that gas companies can transition to be energy companies while still maintaining pipes underneath the ground. So this is a way to transition to using our earth to heat our buildings, and it reduces indoor and outdoor pollution. Also, subsidizing cold climate heat pumps, which are much more efficient than gas, and there's heat pump water heaters as well. And then also making sure that we use public funds to purchase electric appliances rather than using them to purchase gas appliances.
Great, thanks. One of the questions also is comparing national gas in quotes, or I think we're going to call it methane gas. It's CH4, that's what it is. So let's call it what it is, methane gas. Nothing natural about it. How does that compare with other sources of energy, such as oil, solar, geothermal?
Joe, this is really eye-opening. Apparently,
and can you mute yourself if you're not muted? Please mute yourself.
Can you say it in comparison? How do they compare? In what sense? In air pollution? Or?
Air pollution. Yeah, producing air pollution. Oil, for instance, oil furnaces, solar, geothermal. We have very little oil left in New Jersey. We have some, but we know that that's a heavy pollutant. But I think we all agree that oil's no good. But how about solar, geothermal? Are there any adverse? This person is asking about comparing it to that.
So solar and geothermal are there's no combustion with those two types of energy, so you don't get combustion pollutants like nitrogen dioxide and particulate matter. As far as oil and natural gas, they're very similar. Propane, because it's liquid, it's a liquid gas. It has a different profile for the type of pollutants. So it's slightly less, but yeah, I can't go into like exactly how much each of them is, but yeah.
So another question we have, thanks. Another question was that someone's concerned that if you open your window and you live in a very densely populated area, you might be increasing your exposure to worse air outdoors. What have you found with that? Is that something that you found to be true, or is that generally not the case?
Yeah, that's a great question, especially like in California during the fires, people could not open their windows. So if you're in a situation like that where outdoor air is much worse, then you should not open the window. What you can do is get air purifiers that have a HEPA filter with carbon that will clean your indoor air as well as opening a window.
Wow, that's a great idea. Thanks. So let's see, another good question. Are there other countries and states that we should look to for good examples of policies? And we know just, for instance, that in California just now, the California Air Resource Board just recognized emissions from gas stoves as a public health problem. You sent me that article, Andy, that's how I know it. And they recommend stronger building codes. Can you talk about how that could help health and climate change?
Sure. I don't know all of the European building codes, but I know that in Germany, there was a type of building called passive house, which has been shown to reduce energy emissions by 80% if you build to passive house standards. And so that's a great way if using the building code and to use technology that we have readily available is to build to passive house standards with all electric buildings. Passive house does not state which type of energy you should use. It just reduces energy significantly.
Thanks. And Steve, I'd like to just know if you have any comments here. And I also was wondering if you have anything perhaps to add on the impacts of that climate change we know will create in New Jersey, increased heat, increased flooding. Is that going to exacerbate the health impacts from air pollution, or any comments that you want to add at this time?
No, I really don't have anything specific. I mean, we could go on for hours talking about all the other health effects of the spinning wheel that I talked about at the beginning. I do want to sensitize people, however, that underlying all this is our infrastructure of healthcare delivery, and how climate change in general and how catastrophic events specifically, whether it's COVID-19 or flooding or hurricanes, will impact on people's ability to access healthcare, and therefore the outcome of their well-being. For example, just with COVID-19, and same would apply to if we had a flooding or a hurricane event. People who need radiation therapy for their cancer often don't get it, or are delayed because the facilities, the radiation therapy facilities, can't run on generators. You know, they need the electrical grid infrastructure to run. People delay their routine screening events, whether it's mammography or colonoscopy or getting a blood test for prostate cancer screening. And there's data in the context of the COVID-19 pandemic showing that actually lives are lost because people have delayed those screening efforts over the last several months. So all of this, we can focus on the things we talked about today, recognize that individual health and their outcomes are going to be impacted greatly, not only by air pollution, but the whole breadth of climate change consequences.
Thanks so much, Steve. And I see it's 1 o'clock, and we're actually going to finish up on time. I want to thank you, Dr. Steve Averbuch, for joining us, Andee Krasner for your presentation as well. This has been really enlightening. And this is really brings home the point why just recently the American Academy of Family Physicians, you know, with 100 other healthcare organizations, declared climate change a public health emergency. And we need to look at all aspects of pollution, including buildings, as part of our holistic transition to clean energy. So I want to thank our presenters, and I want to thank Marcus from NAACP for being here. And I see Tom Gilbert is here from Rethink Energy New Jersey and New Jersey Conservation Foundation, another one of our partners. And mostly, I want to thank all of you for joining us. Thank you so much for your questions and for your interest in this really important issue.
Patty.
Well, a beautiful, healthy day.
Patty, can I make a quick point before we close out?
Sure.
Again, thank you to everyone who tuned in again. I just want to say this really quickly. What I've heard the entire presentation, it's important. I just want to convey this really, really quickly. A lot of things we're talking about, the things that are going to help us, they're going to improve and preserve our lives. It's about access, it's about income, and it's about ability to get the things you need, like these filters. And Andee, I would love to speak to you about making up like a checklist of things that people who live in densely populated areas need to get. But it's about access. So I just want to say that everyone that's on this call, that's on the Zoom, and you're in this fight for environmental justice, please understand that we also need you in the fight for civil rights, because until Black people have the adequate access and the programs and the public funding are going to Black communities, and we have access to the things that we need, we can't even get in this conversation yet. That's why when you even look at the makeup of this Zoom, it's not a lot of Black people, because it's not on our radar. It won't be on our radar until we start seeing the benefits of it. So we have to be, anytime you see a police shooting, anytime you see unjust housing legislation, anytime you see benefits that are taken or stupid loopholes people have to jump in order to receive benefits, we need you to have that same passion, because once Black people and people of color have a solid footing, then they also can be in this conversation as well. I just want to make that known because we need these other fights that have the same passion that environmental justice is getting. So thank you guys for your work. And I left my email inside of the chat. Please contact me because we need all hands on deck for this fight, and we have multiple fights. So thank you guys again.
Absolutely, Marcus. Thank you so much for making that really important point, and we look forward to working with you and having more of these conversations and getting this important message out and being able to actually help real people. Because this is really what we're talking about are real people. They're numbers. We all saw a lot of numbers, but these are real people, real human beings, real New Jerseyans, and we want to make sure that the people being harmed the most get the fastest and quickest relief. And say we save lives. So that's what this is about. So thanks, Marcus. And again, thanks, Andy. Thanks, Stephen, and Tom, and all our sponsors. We're going to be posting this webinar on our website at njlcv.org. You'll be able to get it there. I will also be able to have PDFs of the slide presentations for people who want them. So thank you again, everyone. Have a wonderful, safe day, and take care. Bye-bye.